My name is Dr. Scott Desmond. I'm an orthopedic surgeon specializing in joint replacement surgery. Today I'd like to talk about the posterior hip replacement approach to joint replacement surgery. The anterior hip approach has become very popular recently, and I continue to use the posterior approach, which I've been doing for 30 years with some modifications along the way. The anterior approach has been said to be less painful, with more rapid recovery and lower dislocation rates, which is one of the complications of a hip replacement. I beg to differ, and I believe that the posterior approach offers much more benefits actually than the anterior approach. The anterior approach is said to be easier for the patient and have much less pain, but a posterior approach done efficiently, as I have perfected over the years, will yield at least equivalent, if not better, results in terms of patient stay in the hospital and recovery to back to normal activities. Most of the patients after a hip replacement go home either the night after surgery or at most the day after that. So there's not a long hospitalization. Most patients use a walker for a week or so, and by a week or 10 days, most patients are either ambulating independently without the need of assistance or at most using a cane. Most patients are able to return to normal activities between 4 and 6 weeks after surgery without having any difficulties. Blood loss after the posterior hip approach is much less than with the anterior approach, and the surgery is done much more efficiently and quickly. The operative time is shorter. There's no need for extra equipment such as x-ray or fluoroscopy, which is a live type of x-ray that's used for most anterior hip approaches. The posterior approach can be done under spinal anesthetic, allowing the patient to avoid general anesthesia, whereas the anterior approach requires the use of a general anesthetic. So in general, the posterior approach yields at least equivalent, if not better, results with much less complication rate than the anterior approach.